Hey Nina, thanks for coming to CARPL's booth. It's always phenomenal to meet you here. So, what do you think about your team's been using CARPL for a while now for validation of AI? So, any feedback? What do you think about it?
Yeah. Well, first of all, validation of AI is an important thing that I think most people recognize that the FDA, when they clear or approve an AI model, they're not clearing it to make sure that it's effective in your environment. They're clearing it for what they call efficacy. And efficacy means, will the AI work in the perfect environment? But we all know in healthcare that no environment in healthcare is perfect, clearly. Data is crazy, the workflow is crazy, and it's all very different. And so if you're going to use an AI model, you have to validate it yourself. And that means validated in your data and ultimately in your workflow. And so we've been working with CARPL to be able to do that, and it's been a real big help. We look at it in a couple different ways. One, we do a validation using retrospective data, and we evaluate anytime the AI says there is a positive finding, or since these are prior studies, the RAD said there's a prior positive finding, and we'll look at it that way. And what we've been doing with CARPL is, because we don't have a truth data set, that takes a long time to create, what we've been doing is these head-to-head competitions where you can have one AI model working against another, two or three or however many you want. And in those head-to-head competitions, they're basically competing against each other. So instead of creating a truth data set, we can do is just see anytime one AI says something different than the other. It actually makes it much more efficient to utilize.
Oh, that's awesome, and we've seen it reduces ground truthing effort by about 80%, which is phenomenal.
Yes.
And yeah, allows validation at scale. So, thank you, Lina.